Have you ever had questions about intimacy that you were too embarrassed to ask out loud? Today, we're going to talk about those private questions openly, without shame, without judgment, and with practical, real advice that can actually strengthen your connection and confidence no matter your age. Welcome back to Talia Talks Love. Today, we're diving into an honest and open conversation about intimacy in later years, how desire, connection, and pleasure can stay alive and even grow stronger with age. Today, we're going to share one of the most open, gentle, and yes, slightly blush-inducing conversations many older adults quietly carry inside, but rarely get to talk about freely. It's time to bring those private questions into the open. When we discuss intimacy honestly and calmly, we do more than learn facts. We ease old worries, connect more deeply, and realize we are not alone in our thoughts or experiences. Welcome back to this warm corner of the internet. This is our space, a safe place to speak about real intimacy, aging with confidence, keeping the body strong, the mind active, and relationships joyful and full of life. Whether you're watching from a busy apartment in Lagos, a quiet garden in Nairobi, or a peaceful retirement community in Florida, you belong here. This conversation is for you. Here's the simple truth: intimacy doesn't retire, desire doesn't stop with age, and passion has no expiry date. Love often grows deeper when we care for each other with openness and curiosity. Today's big question comes up more often than people realize. Is it safe to swallow vaginal fluids during oral intimacy? What about the taste, the smell? Is it normal, healthy, or acceptable? These questions are often whispered in private or typed quietly into late-night searches. That silence can turn into shame, which leads to avoidance. Women have questions too. After menopause or childbirth, as the body changes with time, many wonder about scent, taste, and moisture. They quietly ask, "Is something wrong with me?" My answer is always the same. Curiosity about your body is healthy. Asking questions isn't weakness. It's a powerful step toward better intimacy and stronger connection. Vaginal fluids aren't random moisture, dirty, or embarrassing. They're part of the body's natural design. They reduce friction, protect delicate tissues, support sperm movement when conception is desired, and signal comfort, safety, and readiness for connection. Where do they come from? Three main contributors work together. Bartholin's glands near the vaginal opening provide smooth lubrication early in arousal. The skin's glands near the urethra, sometimes called the female prostate, add more fluid during deeper arousal and are involved in female ejaculation for some women. The cervix produces mucus that helps maintain balance and moisture at different points in the cycle. Together, these create lubrication that can be clear, slightly milky, or somewhere in between. It's a well-tuned system preparing the body for closeness. Taste and scent naturally vary. Hormones, hydration, diet, hygiene, stress, and medications all play a role. Eating fruits like pineapple or citrus may soften the taste. Strong foods like garlic, coffee, or alcohol can make it sharper. Around menstruation, a light metallic note from trace iron is common. A woman's natural scent and taste aren't defects. They are part of her hormonal rhythm and personal chemistry. No two bodies smell or taste exactly the same. Sometimes taste or smell feels different or unpleasant, and that is normal and usually easy to address. Common reasons include heat and sweat trapped by tight clothing or a trace of urine from rushed wiping or limited access to restrooms. Some changes in vaginal fluids can be caused by imbalances like bacterial vaginosis, which often has a fishy smell, or yeast infections, which can smell bready or like beer and may have thick discharge. These conditions are common and treatable. Feeling embarrassed can harm intimacy, but knowledge helps restore it. If something feels off, don't pull away quietly. Look for gentle solutions together. Simple hygiene before intimacy, like a quick rinse with water or a mild unscented cleanser, can make both partners feel comfortable. Think of it like brushing your teeth before a kiss. It's not about shame, it's about care. Cotton underwear and breathable fabrics help, while douching or harsh washes often cause more problems. However, some situations do have risk. Sexually transmitted infections such as chlamydia, gonorrhea, syphilis, chlamydosis, herpes, and HIV can be present in vaginal fluids. Mouth sores, bleeding gums, or small cuts increase the chance of transmission. The risk of HIV from oral sex is low, but not zero, especially if there are fresh wounds in the mouth. The solution isn't fear, it's awareness. Know your health. Talk openly with your partner and test when needed. Make safety a shared value instead of an awkward topic. Barriers like dental dams or condoms cut into a square can reduce risk and still allow pleasure. And some couples make it playful by choosing flavors or using them naturally. Here's a simple approach. First, talk about STI history before exchanging fluids. Ask about the last test and consider testing together. Second, use protection when there's uncertainty or risk. Third, make regular testing part of your wellness routine. For many adults, twice a year is reasonable. When both partners are healthy and informed, swallowing vaginal fluids carries no special danger and can be a natural part of intimacy. Comfort and personal boundaries matter too. Even if something is medically safe, it must feel right. Consent matters at every age. Desire can't be forced, and honest communication protects connection. Some people enjoy oral intimacy deeply, others feel neutral or unsure. If you don't enjoy swallowing fluids, it's okay to say so gently. If you do, it's okay to express that. Intimacy thrives when preferences are shared without fear or pressure. As we age, bodies change, but connection doesn't have to fade. Many older couples report more satisfying intimacy because there's less rush and more presence. There is time to talk, laugh, and learn each other. Again, oral intimacy can maintain closeness when intercourse is limited by health, mobility, or comfort. It allows partners to give and receive pleasure without strain and can build trust and tenderness. Thank you for joining me today on Talia Talks Love. Remember, intimacy at any age is about connection, care, and respect, not shame or performance. Your body is designed to respond, to give and receive pleasure, and asking questions is a healthy, powerful step towards stronger bonds. Talk openly with your partner. Approach each moment with kindness and embrace curiosity instead of fear. Pleasure doesn't have an expiration date, and neither does love. Keep learning, keep exploring, and cherish the closeness you share. You're not alone, and your intimacy journey is still very much alive and beautiful. If you enjoyed this conversation, don't forget to like, subscribe, and hit the bell icon so you never miss a video from Talia Talks Love. And drop the word connection in the comments if you loved this content and want more honest talks about intimacy and